Hello, I'm Dr. Franck Yata, and thank you for joining us. Last time, we discussed that the balance of the sympathetic and parasympathetic systems ensures the proper functioning of the entire body. Today, we're sharing 6 things you can do to overcome stress, which is essential to a good erectile function. But first, let's wrap up on how stress affects your erectile capability. So stress will excite the sympathetic system and thereby inhibit or deactivate the parasympathetic system, with the logical consequence of preventing the normal functioning of the erection. In other words, stress, anxiety, and depression have direct access to the brain, ordering it to disable or reduce sexual performance. Not only that, but they also trigger the production of oxidants and other toxic chemicals, particularly in aging, cancer, cardiovascular processes, and more. Believe me, no one wants to let constant stress develop in their lives. So absolutely don't let stress, anxiety, and depression destroy you. Finally, and we'll talk about this later, we must also keep in mind that the male sex is a muscular organ. It is itself attached to a muscular floor called the pelvic floor, and it needs to be in good shape to perform better. Hence the Kegel exercises and other local massages that we also offer. Ejaculation. This is probably the right time to talk about the process that initiates ejaculation. First, you should know that the brain seems to have a peak beyond which it irreversibly triggers the ejaculatory process. Quick note: don't confuse ejaculation and pre-ejaculation. After forming an erection, many men emit pre-ejaculatory fluid during stimulation prior to ejaculating. This is not a formal ejaculation yet. Ejaculation is triggered by a combination of spinal reflexes and cerebral influence, primarily initiated by stimulation of the genital organ. This stimulation, most often mechanical, sends signals to the spinal cord, specifically to the spinal ejaculatory center, SEC, located in the lumbar region. When these signals reach a certain level, the spinal ejaculatory center will send a signal to the brain, hypothalamus, to coordinate the release of sperm and the contraction of the muscles responsible for expulsion. The first lesson here is that if you are sufficiently aware, you can manage this level and then being able to delay the ejaculation more longer. Well, it's not easy, but it's entirely possible, with a lot of mental training and willpower. This is where defocusing or deconcentrating techniques can help. The second lesson is that if the pelvic floor muscles are flexible and exercised, they will not get tired more quickly during intimate intercourse. As a result, they will not send the signal to the brain to initiate muscle relaxation and blood expulsion, resulting in more erection time. As you can see, any method that delays ejaculation helps solve the problem of erectile dysfunction. This is also what oral medications do by inhibiting the phosphodiesterase type 5 enzyme, such as Viagra.
So, doctor, what shall we do to overcome stress?
Well, from a stress perspective, when signs of erectile dysfunction begin to appear, the 6 following steps should be taken. 1. Get closer to your wife morally, mentally, and especially physically. Without waiting for her to apologize in case of problems or disagreements, seek her out and approach her. Align your views, and if necessary, ask for his forgiveness. This will have an impact on your sexual strength. 2. As far as possible, find solutions to problems that may be causing stress. Fix the disturbed interpersonal relationships, family or work. Go out and socialize with others. Talk about it or seek help from experts. Look for a financial solution. Talk to your religious leader, etc. 3. If you want to be alone, plan to feel good and relaxed. Do what you seem to enjoy. Relax, travel, or change your surroundings if you can afford it. 4. If necessary, improve your lifestyle. Stop consuming stimulants, coffee, tobacco, alcohol, and other psychoactive substances. Adopt a balanced diet. Take steps to ensure good sleep. Engage in regular physical activity and adopt relaxation techniques. 5. Practice dance and classical or soft music. 6. At the same time or after trying the above, take anti-anxiety medications, and even small doses of PDE5 inhibitors from time to time. Thank you for following us. Please continue to the next episode to see what's next. In the meantime, I ask that you kindly subscribe, like, and share our videos so that many can benefit from them.